it's my honor to introduce and welcome to the stage Larry Bonning, retired county judge, and Hank Strauss of our program committee to introduce our guest today. I think you'll really enjoy this presentation, and it has to do with health, which I'm very supportive. So, Larry?
Yes, it's my pleasure today to help introduce our guest speaker, and she was suggested as a guest speaker by our longtime Rotarian and friend of mine, Hank Strauss, who's with me at the podium. He asked me to help introduce our guest speaker. Our guest speaker, Dr. Daisy Dong, will be talking about acupuncture, giving a little of its history and its applications. A few weeks ago when I mentioned to Judge Bob Kopelke, a member of Denver Rotary, that there was going to be a talk today about acupuncture, Bob Kopelke said, well, I am really excited to hear about a talk on acupuncture. In fact, I'm so excited I'm on pins and needles. Blamed Judge Kopelke. So seriously, Dr. Daisy Dong, a native of China, has a medical degree from the College of Traditional Chinese Medicine in Beijing, and she completed a fellowship in acupuncture at the Dongzheim Hospital. She came to the U.S. to attend graduate school at Ohio University, where she completed a master's degree and an internship in Atlanta, Georgia. She eventually earned 3 master's degrees in the U.S., including in health administration, a master's degree in oriental medicine, and a master's degree in international health. In 2005, Dr. Dong was the first clinician hired at the University of Colorado Hospital in its integrative medicine program, where she is the senior member of the acupuncture group. She is also professor at the Southwest College of Acupuncture, where she teaches clinical herbal pharmacology and integrative traumatology. She has a special interest in expertise in acute and chronic pain management, including joint pain, post-operational pain, migraine, and post-stroke rehabilitation. She has a special interest in cancer support care for side effects of chemotherapy and radiation. Henry, do you have any comments you'd like to add about Dr. Daisy Dong?
Daisy is quite erudite. You can trust her.
Okay, well, need you hear about anything more? I'm sure you'd rather hear from Dr. Daisy Dong rather than Henry and myself. Dr. Dong loves to travel, and for several years she loved to swing dance and do Argentine tango. Without further ado, please help welcome Dr. Daisy Dong.
Thank you. Could you hear me? Could you hear me? Thank you very much for inviting me. It's my honor to be here. Thank you for Rotary Club contribution to the public service. I'm very moved, It's my honor, so I mainly want to talk about acupuncture. Time is limited. Let's start. So, okay. All right. So we have an objective learning today because I always teaching. So I've been, do the clinical, have been practice, acupuncture, Chinese herbal medicine, and the general medicine, and teaching, and do a little bit of research for the last 30 years. Started very early, probably when I was diapers. So, okay, the objective is we want to know what is acupuncture, where it come from. Then we want to know what kind of condition acupuncture can treat, and also how much we know about acupuncture in modern, research. And also we want to know, does acupuncture have side effects, right? So where are we going to find qualified, practitioners, and also, things like, does my insurance cover it? So this is a very, very common concern that, we entered, every day in a clinic. So acupuncture basically is non-drug therapy. It's use a very thin metal needle, which is technology is so advanced, so the needle basically unbreakable. Then they coat it with a special coating, so the needle will slide into the tissue without pain. So most of the time you don't feel the needle go in. So, when they choose the points, which is a Chinese medicine belief, those areas accumulated a lot of energy in there. So regulated energy not locally when the needle go into the area, but also distally. Okay, so in most cases, after needle in the place, either in the tissue or touch the nerves, it depends on what's the purpose we try to treat. We use the hand to twist it to achieve the result. This time you will, as a patient, will feel something like a little ache, little muscle spasm, hit on the nerve. So those kind of sensation we call the needling sensation. We actually expected that, but we're not doing for every point, we're doing for key points. So you got to feel it, then the signal will impulse to the brain. So that's the idea. If research also said, if you hook up a machine, it's a 9 voltage machine, so it causes pulsing in the needle, so actually have a better result. So that's, in last 50 years or 60 years, the Chinese invented a machine to do that job. Now the research said it is really better than the, manual. But each person reacted to acupuncture differently. So some people like, I don't like that. So we use manually. If someone very, fragile, we don't use machine either. So it's a, depends on, how we interpret the conditions. So we add the machine on. Okay, Chinese medicine actually has this 4, components. Acupuncture is one of it. Herbal medicine in Asian country actually is the big sell. It's the money maker, just like the pharmaceutical in the Western world. So sell the drugs, So that's the number one. Acupuncture is actually only take 25%, the medical practice and the revenues. But in the Western countries, so it's easy to learn, easy to operate, easy to, study too. So that's become so popular. In 1971, so there's a big, reporter, James Recton, I think that's his name. He happened to have acute appendicitis that ended up in Beijing when he visited there before the President Nixon's first visit. So then they did a regular operation, removed, swollen appendix. Then after operation, then he complained, as everybody do, have an abnormal, operation, distension or constipation. Then he quickly discovered, other, patient, all had acupuncture. So he curious, he said, can I have it? So this abdominal distension really bugging me. So he wrote an article published in New York Times in 1971. I think it is July 26th issue. So talk about his experience. He said it's really working. So release his symptom. So that's the official introduction of acupuncture in United States. So Chinese medicine also has a quite influence for massage world. A lot of massage actually borrowed, even chiropractic, borrowed the concept of a Chinese massage called Tuina in here. Some people this year start to practice meditation, breathing exercise, Chinese breathing exercise meditation called Qigong. It's also a part of martial arts. So basically, Chinese medicine is an independent medical system. What I mean, so number one is credentialed by the World Health Organization. There's only two medicine, traditional medicine can be independent, except biomedicine. Number one is Chinese medicine. Number two is Indian Ayurveda. Why? Because they have all the medicine required to have their theory of etiology, pathology, diagnosis, treatment, prevention, in addition to pharmacology, not only pharmacology application, but also toxicity study, to support it. So because Chinese medicine born in China. So their logic, sense sensibility, and they're, definitely embedded in their culture. So it's totally different, from Western world. So the concept of health and the diseases are totally different. So you said that's odd. The doctor said, Dr. Dong said, I have a kidney qi deficiency, but my kidney is fine. We probably talk about function. The lab hasn't showed up yet, so we'll can already able to, to tell the earth something, going on. So for that. Okay, originally there's no metal needles. In the Stone Age, there's plenty stone, right? So they sharp it. Basically, it's not a puncture. It's a bleeding and acupressure. Then later on, they start to use animal bones. Shaped as thinner to poke on the point. So why does the Chinese medicine, particular acupuncture, get so popular? Because the clinical evidence shows that acupuncture do have a very unique, special value in therapeutic, which this value is not as same as, conventional medicine. So their uniqueness, it have first of all, has a very wide, application, can basically treat almost everything. So, so how good is not an issue. Another thing is, they're very good for the, biomedicine labeled mechanism or etiology unknown. So that's the time you want to see me for, right? Okay, and also very good to manage the chronic diseases like diabetes. Actually, recent publication said that Chinese herbal medicine actually very good to low blood sugar. Then the acupuncture very good to manage pain, chronic or acute. So some people do the survey. They want to see, primary care setting, how many people use acupuncture. Actually, a lot. So you can see 28 to 47% of people go into primary care actually already use acupuncture. 21% of people actually use the same reason they go to see their primary care doctors, such as, allergy, such as hypertension, such as pain. That's a very common thing. Low back and neck pain, that's the most, condition come to see us. So, in HIV patient, more and more, come to see us too. All right, so this is a list. So you can see the pain is dominated conditions. Recent years, people found cancer actually, conditions actually can be used, can ask help for acupuncture. So what do? We're not really treating cancer per se. Actually, we give a support treatment. So chemotherapy, radiation therapy, or post-surgical. So they all has problems, So then those the people come in to see us the most. So we support the immune system. We treat their GI upset. We treat the drug, a toxicity. So that's what we are good for. So, I was invited for a talk in LA next year, just talk about how to use acupuncture treated, among the colleagues. So only, for the acupuncture. Then other conditions, we have anxiety, depression. Believe or not, a lot of psychologists, psychiatrists come to see us because they don't want to take drugs. So that's the reason. Recent years, a lot of research actually found help the infertility, for people who really want to try but haven't been successful. If you ask for half of those people has no organic problems, and they even could not find any lab has anything wrong with them. That's a particular, frequently I see in the Western country. There's nothing wrong, but they just tried again, 3-4 years, could not pregnant. So then we have a lot of success by research, by clinical evidence for that. And also during the pregnancy, we all know the morning sickness, those kind of things, and gestation hypertension, those kind of things is also we can help. Then the induced labor, more and more people start to turn on us and said, could you do something to make me labor easier? So I said, sure, we can do it. Just don't wait until last minute. We do need 2-3 sessions, for that. Then baby will drop, then the muscles in the bottom will relax. Then some people said, I never use a drop of the drug, during my first ever labor. So that's how good, can do. The age group. So of course, educated women, in particular, and the middle, age to seniors more and more come to our, clinic looking for, alternative medicine. I have to point out the younger group, because their parents are so educated, so the younger group start to, come to see me from 6 months old to 17, 19. So they actually doing pretty good. We're not necessarily using needles. We can do acupressure, we can do a little twina. So, when we use a needle, we use a different way than, we use for adults. So it's different. Then WHO, so actually in 2003 already published based on the research published, so acupuncture can good for the 44 conditions and the symptoms. Sorry about that, misspell. So the 4 categories basically list here. On your table, there's some red sheet. So I only list the first 2 categories. So based on the clinical trial, so you can read it or take home. So for that, let's look at the first category, which is well research based on control trials. Then, so what they can do? So you can see it's quite range, right? A variety of medical conditions or symptoms for that. Chemo radiation adverse effect is on the top. So that's, how good. Basically in China, I follow that, oncology trained by, Western medicine and has a special training for the herbal medicine. He said we use all the time, in chemo, off chemo, so we use herbal medicine and acupuncture all the time because there is no conflict, at all. So you can see there's a lot of conditions. Then we look at the next slide, pain. It's a variety of pain. So this is based on the research. So, some conditions never researched, so it just, a lot we can help with. Let's look at this video.
But we'd be crazy to write off ancient wisdoms. We ought to question them well, but we can't write them off. Especially when it appears to be able to do something astonishing. In the city's most advanced hospital, 21-year-old factory worker Chun Gunlian has a hole in the heart and her health is deteriorating. She's about to have open heart surgery. Even with the best medical equipment, it's a risky operation. Her chest will be cut open and her heart stopped. But Gunlian will go through all of this without a general anesthetic. Instead, she's chosen acupuncture. Although sedated by drugs and her chest numbed, she'll be conscious throughout the whole procedure. The doctors stimulate the needles using an electrical current. As the surgeon begins, the success of the operation depends not just on his skill, but on the power of acupuncture.
Acupuncture is an effective painkiller. It's also less damaging to the body than a general anaesthetic.
It seems incredible, but Gunlian's doctors have done more than 300 similar operations. Gunlian's operation is entering the most dramatic phase. They check she's okay as they prepare to stop her heart to repair the hole. It seems amazing to me that acupuncture is even considered for such a life-threatening operation. But after 2 hours of intricate surgery, everything appears to have gone well. Remarkably, just 2 days after the operation, Gunlian is sitting up in bed, telling her sister the story. Her memories are still vivid.
I remember the doctor stuck a needle into my hand and felt my pulse. Then he put another needle in here and here near my vein. Then my whole body started to tremble. When the scalpel started to cut the bone, I could hear it all. But I didn't feel any pain, not a thing.
The speed of Gunlian's recovery is impressive. Just a week after the operation, she's ready to check out. And there's one other benefit to the acupuncture. The bill is a third of the cost of an operation with general anaesthetic.
Okay.
Robert knows about the smoothness of
So the time is limited, so we're gonna run very quick, then we'll answer the question. So I want you look at it, So acupuncture based on the meridian theory. So basically, it's like a globe, has a longitude, latitude line, but inside there's a 6 meridian, doesn't have a point, so they connect inside. So that's the energy can circulate. So I emphasize on interaction and this is a meridian series research they found. Actually, they think it is very similar to the biomedicine neurovascular system. So because they connected as a distals internally, externally, it's just like that. So they use math calculated in that way. So basically, it's just what they said. You can see the nerves on the one side, then the meridian on the other side has a stunning correlations or similarities for that. So then basically the research think, so that's the rational base of acupuncture. They keep saying need evidence, so basically this is the most evidence. So acupuncture stimulated the skin and the muscle, basically a lot of sensory nerves in there. Those sensory nerves travel with the, called the dendrite, which is neural cells, then go to the brain, and stimulate the 3, important system in the body through called the HPA axis. So then they boom cause the immune system acting up, endocrine system acting up, and also neural system acting up. Then as a result, they can treat a very broad problem because anti-inflammatory, pain relief, analgesic, and also neurotransmitter make it relax. So that's basically that's acupuncture, can do. So it's a global effect plus specific effect. That's every, this is a biopsy support, so the needles basically in this kind of environment reach muscle and reach vessels. In this kind of it's a mechanical stimulation causes a chemical reaction, so to the brain. So the brain will like assess it. Should we inhibit it? Inflammation like a prostaglandin. Should we, stimulate a GABA receptor? Should we relieve, beta endorphin for the pain management? The brain just so smart. So that's they figure out. Then you will see outside of the reaction is like that. So acupuncture basically is restored normal function. So then the researcher also said, so it compete with the pain signals in the brain. Then which is in the pain areas, like anterior and singular. So those kind of area is a receptor of the pain. So acupuncture go in there, take their place. Then the brain or the body just like, where is the pain? There is no pain, and you don't feel the pain. So basically that's the idea. Okay, I'm gonna open for the up for the questions.
Craig, go ahead.
Dr. Dong, thanks for being here. I'm not so sure I'd want to be awake when somebody was doing open heart surgery on me. I heard it said earlier, and you had it in the presentation, that the concept of Chinese medicine in China, you pay the doctor to keep you well. Here in the United States, you pay the doctor to make you better. Can you talk about that?
Yes, the concept's so different, So as I said, it's a grow in the cultural. So they basically allow the people know what to cook, based on the season, so they won't get sick. Then even when they get they have a question, they make appointment. The appointment basically covered by all the insurance. Then they said, oh, it's just I think I have asthma. Fall season usually causes a problem. What should I do? So that's they ask. Then they say, oh, you may want to do this. You may want to do that. They say, sure. So they may give us some herbal medicine, get an acupuncture treatment, or they may give a prescription, say that if you have a symptom now, so you can do that. That's very common.
I have really a comment more than a question. Personal experience. I completed 2 episodes of periodontal surgery on a patient in 1995 who was allergic to any anesthetic and all pain medication. She had acupuncture for the surgery and had no pain post-operatively.
Thank you. Yeah. So it's quite safe. You can see this slides, so the incidence rates compared to the biomedicine actually this team. Yes, okay. So most people feel, very relaxed. Insurance is a bummer. So Anthem and the United States Healthcare is only I know cover it. Other insurance cover a little bit too, but so it always asks you insurance, do I have acupuncture coverage? Even you are with Anthem or United Healthcare, it's not for everybody, so.
Jim, why don't you get the microphone there first? We can't hear you.
I see him over there now. However,
sorry, we can't hear you. Can't hear you, Jim.
I would have a question about how you treat biliary colic. I would like to know how you treat hypertension of the primary variety.
Okay, hypertension actually come to see us, as not often as, but actually it's a very strong suit for us. Acupuncture can do it, particularly when your blood pressure, really raising up. So it literally can, reduce 20 to 10, 10 to 20, milli. Mercury immediately. Then usually we use herbal medicine to maintain it. It's never conflict with your prescription drugs. Yeah, actually it's same goal of that, just use a different route, for that. Then herbal medicine usually is a combo, more than 5 ingredients in there. So it's the interact and also counter the side effect. So basically, you just have to spend money out of pocket for it.
I would also have some questions about neurological things. I happen to have a background in significant neurology. A full course, as a matter of fact. And I would be very interested in how you treat that. Now, I'm acquainted with hypnosis. As a matter of fact, I have hypnotized patients that refuse to have otherwise treatments. But I do understand that, so I'm not going to pursue that. But the hypotension bothers me. Also, the stroke treatment by acupuncture.
Post-stroke in China by neurologists, they all know that's the first line of treatment. So after acute stage, so they immediately sent to acupuncture department. Then in addition to physical therapy, because the result is just a phenomena, so.
I think we've run out of time, but I wanted to thank Dr. Dong for a wonderful presentation. One of the things that I found very interesting about this is that when I first started learning about acupuncture years ago, I was under the impression that it was very much tied with a concept called energy flowing through your body called qi. And it seems as though that now we've got this explanation of the neurology behind it, which is, I think, starts to explain it in Western terms. Would that be accurate? Okay. Well, please join me in thanking Dr. Dong.